Today's video, I want to educate you on how to give yourself a testosterone injection. I am making this video obviously to help the general public, but also I can use it in my own practice with my own patients. When they ask me, how do I do this? I'm just going to point them to this video. Hey YouTube family, today's video, I want to educate you on how to give yourself a testosterone injection. I am making this video obviously to help the general public, but also I can use it in my own practice with my own patients. When they ask me, how do I do this? I'm just going to point them to this video. So if you're an individual who's suffering with symptoms of low testosterone, like low libido, decreased energy and mood, loss of lean muscle mass, to name a few symptoms, you may be prescribed or recommended to take testosterone hormone replacement therapy. One of the most common ways that it is prescribed is via an injection. I know it sounds really scary, but it really isn't. And injections can sound daunting and scary to anyone, but I want you to keep watching this video because I'm going to teach you how to give yourself a very simple testosterone injection. Okay. So first, your testosterone will come in a vial, and you first want to draw up your dose. So this is an example of a vial, and yours might look a little bigger or smaller, doesn't matter. But you first want to draw up the dose that's prescribed to you. Your prescription will tell you exactly how much to give yourself. So you want to take the vial and turn it upside down, because then all the solution comes near this rubber stopper where you're gonna insert the needle, okay? So if you're using a new vial, it'll have a cap on it that you just click off. That cap doesn't get back on, okay? That cap is a one-time thing. So if you ever get a new box and it has the cap already off, like the metal cap over this, and you just already see the rubber stopper, then that's been tampered with, and don't use that, okay? All new vials should have a metal like foil cap over it. So you take that off and that gets thrown away. You can't recap it, but this metal stopper won't allow any solution you can see to go through it, all right? And you can still use this for multiple additional doses later on. All right. It's a good idea to take a alcohol swab. I don't have one here with me, but you would take an alcohol swab and just swab the rubber stopper to kind of clear any bacteria and grime that might be on top of it. Alcohol swabs can be easily obtained anywhere. Okay, so just take a little alcohol swab and wipe and let that dry for several seconds before you stick your needle. And so what you're going to do is you may get recommended to have two sets of needles, a bigger, large needle, which looks really intimidating. I'll show you what it looks like. Ginormous needle, okay? Usually this needle size is just for drawing the medication, meaning pulling it out of the vial and into the syringe, okay? It's not for injecting, okay? It's usually an 18 gauge. The thing about needles, so you guys know, the smaller the number of the needle, the larger the needle is. So 18 gauge is larger than 20, 22 gauge. 14 gauge is larger than 18 gauge. You get my point, all right? So again, if you have a really large needle, especially 18 gauge, you do not want to use this to actually inject your body. That's going to hurt really badly. It might cause significant bleeding and bruising. So you use it just to drop the medication. And I already have some medication in this, but I kind of just want to show you what this would look like. So I'm going to put this 18 gauge needle on a new syringe, okay? So this is my syringe and my needle, okay? Now, depending on your dose, again, your prescription will show you, it may be 1 milliliter, it may be half a milliliter, it may be 0.2, 0.3. These are usually 1 milliliter or less amounts, okay, that we are prescribing. Again, you turn your testosterone upside down, so rubber stopper is down below and the fluid is on the bottom, and you push your needle inside. Now, your syringe may have a little bit of space with air in it already. If that happens, you push the air in and that allows air to rise to the top and push more fluid down. If it doesn't, that's okay too, okay? But basically, you're going to slowly pull back on this bottom stopper. And as you're doing it, you should see your syringe fill up above this black area with solution, okay? Or with the medicine, all right? And so the top of this black line where you would measure what the dose is, okay? So for example, I've drawn up here in this syringe already, I hope you guys can see the numbers, but it is about at the halfway point. So this is about half a milliliter or cc. This whole syringe is 1 milliliter. Make sure you know what syringe you're using because you may get a different size syringe. You might get a 3 milliliter syringe, and so therefore your numbers are going to look different. Okay, so don't give yourself the wrong dose. This is a 1 milliliter syringe, and so half of this is 0.5 milliliters. So if this is what I would draw using that large 18 gauge needle. If you see a lot of air in your syringe, push that back into the vial before you pull out the needle. You don't want to be pushing air into your body, ideally, and plus you're not giving yourself the complete dose. So you want to make sure the whole column is full of liquid and there's no air in it, okay? Or very, very little air. Just push it up into the vial. So testosterone injections are almost always prescribed intramuscular, meaning injection is done in the muscle. The biggest muscles in our body are our gluteus maximus, our booty, and the second largest muscle in our body are our quadriceps, or the front muscles of the thigh, okay? You got your thigh, you got your booty, all right? So stick to your butt or your thigh for these injections. The thigh is maybe easiest for most people because it's right in front of you. If you're giving this to yourself and no one else is helping you, it may be easiest for you to do it on your thigh because it's like literally right in front of you. You can sit down and see the muscle. You can still inject in the butt by yourself. It's just you have to kind of turn your body. If somebody else is giving you the injection, then they can choose to go back in the buttocks. That is probably the most common place for injections, particularly when it's being given by somebody else. So I'm going to describe how it's done in the thigh first. You want to sit down with your thigh exposed in front of you. So wear some booty shorts or sit down nude. And you want to mentally divide your thigh into 3 sections from your hip to your knee. Okay, so going from up to low. And there's an upper, middle, and lower section, like in this photo. Give yourself the injection in the middle section on the outer portion of the thigh. You don't want to inject the inner thigh because that'll hurt more. There's more important blood vessels there that you may accidentally hit. So you want to go on the outer thigh portion, mid-thigh, outer thigh portion. If you're doing this for your butt, the best location here is your upper outer buttocks, okay? Almost near your hip bone, almost near your hip. You want to get that upper outer butt. If you feel for your hip bone, go back from there and you'll feel your butt muscle. And you can even do a little butt clench and feel the butt muscle to help you find the spot better, okay? Like in this picture, the upper outer buttocks is where you want to go. So now that you've picked your spot, you're ready to inject. So wipe the area that you're going to inject with an alcohol swab as well. Remember, you use the alcohol swab for the rubber stopper, but you want to wipe that area too. So you've wiped the area and you want to relax. Injecting in a relaxed muscle is much less painful than injecting into a tense muscle, okay? So you're going to take your syringe and use the smaller needle that you were prescribed or given, not that big 18 gauge. You're going to use a smaller one, might be a 23, 25. They don't usually go lower than I think 25 or 27 because it can get hard to push the medication in. You may only get prescribed one needle and it's usually the injection needle. So you can just use that needle to draw it up and to inject, just as an FYI, okay? So I've got my injection needle inserted into the syringe and these things just twist, okay? It's really super easy. You just twist and it's just a twist, okay? To take off and to take on. And I want to enter the muscle straight at 90 degrees. And I want to do this quick. Again, you're going to relax and just go quick. You don't need to go the full length of this needle. This needle is long. You might get different size needle, but your muscle is not that deep inside, especially when you're talking about your quadriceps and your upper outer buttocks, okay? So once the needle is in, I'll push the needle in. Once I stop there, again, just a little portion of the way. This, you want to get probably, if I'm looking at this needle, I'm getting this needle in at least like a third of the way in. Okay, so how much of the needle do you need in? It's in the muscle. Your quadricep muscle and your outer upper buttocks muscle fortunately aren't that deep, but I would probably say for the average person that they probably want to do a third of the way in to get to the muscle. This needle is, I believe, 1.5 inches long needle. So once the needle is in, you've done that quick, just go after you zen and relaxed, quick go. Once the needle is in, you push all the medication inside the muscle. Okay, push all that medicine inside the muscle. Okay, and then once it's all in, you pull out. Most of the time, there's little to no bleeding, but if there is a little bleeding, you can just hold pressure at the injection site for a couple of minutes, all right? You want to throw the needles away. Do not reuse needles as they dull, and a dull needle will hurt more. You want a fresh needle, okay? Ideally, you throw the needle away in a sharps container or a needle-safe box. A sharps container is a plastic container that only has one entry point. You can't pull things out of it, and so you would dispose of the entire thing in the sharps container for safety, and then that sharps container can then get discarded. If you don't have a sharps container, please, please, please be careful and cap your needle back and wrap it back into the old wrapper it came in, and then put it in a plastic bag, and then put that plastic bag in the trash to protect those handling your trash. So that's it. I hope that helped a bunch of you guys. And moreover, I hope that if you're a patient of mine and you just got started on testosterone injections, that this video helps you. Please let me know what you think. And make sure you like this video. Make sure that you subscribe and tell a friend to tell a friend to tell a friend to join all of us here every week down there, right here. Bye.